And now it's Boomer Life. Lifestyle ideas designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life with Sterling Fox.
AM 650.
Smile a little smile for me, Rosemary, Rosemary.
It's Boomer Life on AM 650 radio, and no, I am not Sterling Fox.
You are Sterling, but not Fox.
Not Foxy, no. Today we're talking about lifestyles. We're talking about tooth implants, and a couple of special guests on the program this morning, Dr. Bobby Birdie and Dr. Ron Zolko. A couple of great guys. You guys are, I mean, you take the fear of going to the dentist just like that.
I sure hope so.
I would feel comfortable with you.
That's great.
I really would. But we're still working on the can of nitrous oxide.
We are.
Dr. Bobby, during the break, you were telling me a little bit about a patient of yours that you saw that was from the island. They went and saw, tell us that story. They saw the dentist in Victoria.
Well, a patient of mine, I was just telling him over the break, a patient of mine saw a dentist in Victoria and was told that there's no such thing as an implant specialist or a specialist don't place implants. Well, I would venture to say that's pretty incorrect. That's why they ended up being in our office, is that the majority of implants are placed by specialists in town, and whether it be an oral surgeon, a prosthodontist, or a periodontist, the majority are placed by specialists. Now, there is no such thing as an implant specialist, but most of the implants are placed by specialists in town.
So I go to the dentist, and does the dentist have to give me a referral to come and see you gentlemen?
They do not.
Really?
They do not. We're here to treat anybody. They can be referred by their own dentist, and we're not here to take people away from their dentist. We like to work in harmony with their dentist. So if they have a established dentist, and they like an opinion as to where they stand in their dental health, they're more than welcome to come in and let us have a look at them, and then we'll correspond with their dentist to give them the best care that the combined group of their dentist and ourselves can do. But they don't need a dentist if they want to come in.
So when somebody goes to your clinic, they're not there for just gentle dentistry.
Oh, they could be. Absolutely.
Could they?
They absolutely could be.
Yeah, depending. Not everybody does everything. So if they're looking for general dentistry, they can get their teeth cleaned in our offices. They can have crown and bridge reconstructed, advanced restorative dentistry. All of that can be taken care of. And if they need some basic fillings and things like that, we can find them a general dentist who will take care of those little things that we don't manage.
Interesting. And when people come to see you, they walk in kind of sad, and they're supposed to have their hand over their mouth like this because they don't want to smile at anybody in the elevator going up there. But when they come out, they're happy.
Well, we change people's lives. It wasn't intended that way to start with, but when you do this type of stuff and you make people look a lot younger, feel a lot better, feel confident in their smile and how they present to other people, you literally change their life.
And that's really, I think, mostly. I think the biggest changes are for the patients that we provide that service in one day for. You know, the people that are wearing dentures are going to lose their teeth. The fact that you can give them a new smile and a new set of teeth in one day, it's life altering. It's kind of like laser eye surgery. You know, you don't have to reach for your glasses. You don't have to reach for your dentures anymore. It's pretty amazing.
It gives them confidence.
And you don't have to cover your mouth anymore.
Yeah.
Is that true? Oh, okay.
That's right. The confidence is there.
Yeah.
Ron, before the break, you touched on oral health, and you said things in your mouth can affect the rest of your body, right?
Correct.
What does it do? I have bad teeth. What's it going to do to me?
Well, if you have bad teeth, it presumes, of course, there's a bacterial or some type of microorganism that's getting into the gums. It's actually Bobby's specialty here. But what happens is that these tissues become infected and inflamed. The blood vessels start to engorge and the tissues become thick, and now you got a portal, which those bacteria, microorganisms can now get into the blood system, and the blood system isn't just around the mouth, it's through the whole body. And now we find microorganisms that may have started in the mouth can get into the brain, it can get around the heart and joints, and it can cause all kinds of issues.
Now, if somebody has first of all, let's start with injury or whatever. I bite myself a lot for some stupid reason. I talk and I bite myself a lot. But I notice that things in the mouth seem to heal quickly. Mm-hmm. Is that because of the blood flow?
Absolutely. That's the number one reason why.
Yeah.
And saliva.
Yep.
You think how animals lick their wounds to heal? It helps clean, but it also is a factor in the healing.
That reminds me of another joke. About don't let a dog lick your face and you want to know why. I think you know why. Where are your offices located?
Well, Ron's got his office over just on City Center, just off of Broadway. Just off of 12th and Cambie.
555 West Broadway in City Square.
And then we've got 2 BC Perio offices. One is a brand new center in Coquitlam. It's just off of Johnson Street, right next to the Coquitlam Center. And then the new kind of flagship center is on Willow and Broadway. And grand opening is going to be May 13th, 14th. We're open already, but it'll be the big kind of celebratory kind of ceremony at that time.
You're like a big kid. You're kind of excited about this,
Oh,
aren't you?
absolutely. It's amazing to be able to build something like this and to show it off a little bit and have some friends come by and take a look. It's been great.
Now, after the show, somebody goes, gee, that was kind of interesting what those gentlemen were talking about, but I'd like to get more information. Do you have a website?
Yeah, we do. It's bcperio.ca, so it's and then we have a phone number as well, and you can go to zokel.com to see Dr. Ron Zokel as well. So, yeah, definitely.
What I'm going to do now is get you to spell the URLs for your website. So in your case?
So it's bcperio, bcperio.ca.
And Dr. Zokel?
And Zokel is ZOKOL.com.
So you have all sorts of information on there.
Absolutely.
Big font for us baby boomers to read.
Lots of videos.
Lots of videos. Do you get people coming from out of town to see you?
Lots.
Really?
Yeah.
Yeah. I have a referral base that goes into Taiwan and Switzerland, Bermuda, various parts of the U.S.
Yeah, we have people flying in
Lot of
from
parts.
all over the world and all over the country to come in. So it's not unlikely. I have a patient that flies in from the Yukon regularly. I have a patient that flies in from northern BC. It's not unlikely for someone to come in from the States or overseas. Yeah, absolutely.
Is that because there's nobody up north that can do this kind of work?
No, absolutely. I don't think that's always what it is. Sometimes it's just a matter of coming in to see us, just to see the expertise, and they're comfortable with where they're coming and who they're seeing. Plus, we got a hotel next door, so it helps out.
That helps, yeah.
And I think a lot of it's a trust factor as well. When you have confidence in somebody and you believe that they can do the best for you, you'll go anywhere you have to go to make sure you get the quality of care you think you're getting.
Well, really, I'm not going to let somebody put their hands on my mouth that I don't trust.
Of course.
Absolutely.
And no should you. That's right.
Thank you. I feel kind of silly saying that, but thank you for saying that. Do you get a lot of, like, Mary comes to see you? And she walks in sad, she leaves, she's happy, she's smiling in the elevator. Everybody says, what the hell are you on? Because she's smiling so much. But now, do you get that Mary will go home and tell her neighbor Sally about you, and a lot of referrals that way?
Yes. And we do promote that because people often congregate with people like themselves. And if we enjoy people and enjoy treating them, we do invite them to bring friends that are like themselves.
Yeah, it really does help because word of mouth and the sense of that is such a big deal, and especially if you provide a good service for someone to help their friends and their family out is a benefit for us. We enjoy it. It's fun.
I guess so. How many people work in your office?
I've got myself, and then there's 3 other specialists in my office, and then Ron works in my satellite office right now. And then we've got hygienists and assistants. I think there's a total of maybe 15 people in the office. So.
Wow.
Yeah, what ended up happening is I ended up taking 3 practices and kind of putting them all together to make a center where we could provide all the services together.
And I don't know if this is a rumor or not, but are you opening an office in Coquitlam?
Yeah, the office in Coquitlam just opened. It's this past Wednesday.
Right.
Yeah, this past Wednesday was the open house and went really well. So it's nice to be in the Tri-Cities area. It's a great neighborhood, and we're right next to the mall, so it's a lot of fun.
So after work, you go shopping.
Absolutely. Yeah.
You're listening to Boomer Life on AM 650 Radio, and our guests today are Dr. Bobby Birdie and Dr. Ron Zokel. You've heard of these gentlemen. They do wonderful work. They'll take your life, your miserable, wretched life. Well, I shouldn't say that, but some people are not very happy, are they?
No, it's true.
Besides smiling and laughing and feeling good about themselves after they come to see you at your office and they get the implants put in, there are other benefits like they can eat apples, steak again.
Oh, yeah.
Yeah, definitely.
Literally. And often they look a lot younger when they're done.
Really?
10, 15 years sometimes.
I've heard, and tell me if this is true or not, but if you lose teeth, things change.
Well, you lose bone.
You lose bone.
And if you don't have anything inside your bone stimulating the bone, your bone goes away. That's why you lose teeth. The root of the tooth's gone, so you lose bone in that area. And dentures don't help either. They just push on things, so they're not going to help either. So that's what an implant does: is it stimulates bone.
And all these structures in the front of your mouth, around your mouth and such, collapse inward. So you get more vertical lines. You get a smaller distance between the tip of your nose to the tip of your chin. All of that is associated with aging, visual perspective of aging. And as soon as you open that back up and fill it all out, that person looks like they just lost 10 years. In a heartbeat.
Absolutely.
Let me ask you, for the cowards out there, and there must be a couple, hands up. Can you promise that people aren't going to feel anything while you're doing this?
No.
Okay.
Can't promise it. But
But
if you go to our testimonials, I can show you dozens and dozens, and you can pick the names, and the chances are about 90% of the time they went through almost every little bit of surgical treatment and care without any pain,
Yeah.
even after they come out of their anesthetic.
So do we just freeze people up, or do we knock them out, or?
It's a combination.
There's a combination of. I think there's an opportunity for someone to get just normal anesthetic and freezing, and also to be sedated somewhat as well. So I think we've got all those options available. It's a matter of just speaking to the patient, deciding what's best for them.
So you must deal then with people that come into the office and go, "Hey, I'm pretty cool. I can go ahead, doc, climb into my mouth, do what you want." And there's other people that are like a
Absolutely,
tray. So
absolutely.
And
Yeah.
there's a lot of people who start with
Exactly.
that fear.
Exactly.
And after they had their first procedure, they went, what am I afraid of? I didn't need to be afraid. And they're falling asleep the next time they come in.
Yeah. Oh, it's so true. There's some
Really?
people that come in that are so apprehensive, say, "Doc, knock me out, do this, do that," and then you get through the first procedure, and they're like, "Wow, that was really, really easy." So, because a lot, anytime we do anything when it comes to anything sedation wise, it takes some more time in your life, and there's an increased risk with it always. So it's nice to do things with people that when they're not afraid.
and you can give the needle so they don't even feel that.
Absolutely.
General, yep, it's true.
You guys are rock stars. aren't you? Let's give your website again.
bcperio.ca, which is bcperio.ca.
And Zokol, ZOKOL.com.
I would imagine you guys are, how can I put this gently, quite popular, so you must have a long waiting list for people to get in to see you.
We do have a lot of people coming to see us. I think the best thing is what Ron and I both have done is every week we leave some spaces open for people that listen in from the radio, and everyone gets a complimentary consultation. So the first consultation when they come into the office is a free consultation, and I know the word free is kind of taboo, but that's kind of what it's like. You come in, you'll sit down, we'll do an examination, and you'll know all the issues and problems and kind of where to go from there, and it won't cost you a dime.
When somebody comes to see you for the very first time, obviously they have questions.
Yep.
If you're like people that I know, they have a list of questions. And you go, I don't have that much time, but what sort of things are they asking you?
A lot of times it's how long is it going to take? What are my options? You'd be surprised at how few people are actually know all the options that are available to them. That's the biggest thing. That's why I think Ron and I do these complimentary consultations. That someone can come in and you'd be surprised at what you can actually have done and all the things that can be done. So it's amazing. I think that's one of the biggest things is they get to know what really their options are.
And when you're seeing patients, do you sometimes have to correct what other dentists may have? Well, you know what I mean.
You know what? I think that we're all trying to do our best, but I think there's always something that we have to do, and everyone's got a different skill set. So it's just a matter of working on people and trying to provide the best service overall.
Interesting. And let me ask, who do you see more of, males or females?
Well, I think it's pretty even.
I think it is. There's a tendency for, I think, females in my history to come forward. Men are more reluctant to say, I don't have time. I'll have to get on with business. Whereas ladies are more self-conscious and more concerned aesthetically than some men are. So I would have to give the slight edge to the female side.
And maybe too, it's because that the female naturally is the caregiver in the family.
Sure.
You know.
Yeah, I think as soon as we've gone to and been able to predictably provide this teeth in one day, I think we're seeing more men come in though, because they don't have to go through this long-winded process. It's done really quickly. And they're like, well, I can take anything for a day. You know, that's the mentality. Even the ones that are a little bit afraid or a little bit scared, they're like, well, I could probably do that. You know, so it's amazing that way.
Yeah, and truth is that if they see that they can get this all done in one day, they're not missing out on business. So technically, it's business oriented. And when they can have lousy looking teeth and go to beautiful looking teeth, solid and fixed in one day on implants, for them that's a massive potential for doing more business and even improving their business relationships because of how they look.
Let me play the devil's advocate. I've heard both of you gentlemen now say one day. Is it true? One day, one visit?
Yeah. So
Really?
you come in, we check you out, we take some records, and you plan your day. And that day comes in, and we either remove teeth or we place implants, and you get a fixed bridge that day.
Have you ever seen someone who has never been to the dentist ever in their entire life?
Yes.
Have you really?
Yes.
You go, oh my God, there's an awful lot of work to be doing here.
Well, it is, and sometimes you'd be surprised how well some of them do because, you know, a lot of times they'll be in their 30s or 40s, and it's amazing that they got that far.
Wow. I don't know how they do it. Scary situation. Can we twist your arms a little bit and get you to stay here till noon?
All right.
Absolutely.
Okay, because I've got something that you might be interested in a little bit later on. It's Boomer Life on AM 650 Radio. I'm Tom Lucas. Our very special guest today, we're learning all about implants, Dr. Bobby Birdie and Dr. Ron Zokol. And again, we invite you to call in if you have any questions or concern, or you just want to say hi to these guys. The telephone number in Vancouver, 604-280-0650. Or out of town, it's a toll-free call, by the way. You might be up in Prince George. We've had clients from Prince George and up in the hinterland come down. 1-877-280-0650. It's 11:29, and you're listening to Boomer Life right here on AM 650.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on AM 650.